Chapter 12, Vital Signs. Learning objectives. List 4 physiologic components measured during an assessment of vital signs. Differentiate between shell and core body temperature. Identify the 2 scales used to measure temperature. List 4 temperature assessment sites and indicate the sites considered the closest to core temperature. Name 4 types of clinical thermometers. Discuss the difference between fever and hypothermia. Name the 4 phases of a fever. List at least 4 signs or symptoms that accompany a fever. Give 2 reasons for using an infrared tympanic thermometer when body temperature is subnormal. Describe the technique for assessing body temperature with a temporal artery thermometer. List at least 4 signs and symptoms that accompany subnormal body temperature. Identify 3 characteristics noted when assessing a client's pulse. Identify 3 characteristics noted when assessing a client's heart rate. Explain the difference between systolic and diastolic blood pressure. Name and explain at least 4 terms used to describe abnormal breathing characteristics. Discuss the physiologic data that can be inferred from a blood pressure assessment. Name 3 pieces of equipment for assessing blood pressure. Describe the 5 phases of Korotkoff sounds. Identify 3 alternative techniques for assessing blood pressure. Vital signs consist of body temperature, pulse, respiratory rate, blood pressure, and pain. Pain is the 5th vital sign. Is the following statement true or false? Pain is considered as the 5th vital sign. True. Pain is considered the 5th vital sign. The other vital signs include body temperature, pulse, respiratory rate, and blood pressure. Factors affecting body temperature. Food intake, such as protein, will increase the body's heat. Anorexia decreases the body's heat. Age, the older the person, the lower the temperature. Infections in older people do not always raise temperatures. Circadian rhythms, if you work night shift, your body's going to be cooler as opposed to days because your circadian rhythms are in reverse. Emotions, hormones, anxiety increases your temperature, depression decreases it. Illness or injury raises temperatures through infections, fluid loss, injury, skin impairment, and circulatory injury. Temperature regulation is done by the hypothalamus. In infants, they have limited sub-Q white adipose tissue. This tissue does provide heat insulation and cushioning internal structures. They do not have a good regulatory system for temperature, so it is inadequate. So there is no shivering or perspiring like there is in adults, so they're at greater risk for increase and decrease in temps. They are unable to prevent or reverse a heat loss or heat gain without a caregiver's response and intervention. Normal temp is 96.6 Fahrenheit to 99.3. Core temps are 97.0 to 99.5. Centigrade 35.8 to 37.4. You must report abnormals above or below. You must intervene and you must reassess frequently. Infants have 3 times greater surface area. They also have a higher metabolic rate and a higher need for calories for sustaining body functions. The elderly progressively have impaired circulation. They cannot lose or gain heat as well by dilating and constricting blood vessels near the skin. Infants can generate heat without shivering. There's brown adipose tissue called BAT, and there's white adipose tissue called WAT, and the adipocytes, which are those cells with fat, are filled with mitochondria, and they increase metabolism and increase heat. They're near the neck, chest, upper back, and more so in the infants. and BAT is very low in adults. However, in cold environments, adults can develop BAT, which is the brown adipose tissue. Depending on the climate, cool temperatures cause vasoconstriction at the surface in the blood vessels. The blood gets shunt to vital organs. Brain cells are protected with temperatures in cold water drownings. The brain cells are protected the longest. People that live in colder climates have increased BAT, like I talked about. Increased BAT also increases your metabolism. Norepinephrine starts breakdown of fat for warmth. Lipolysis also. In the hot tropics, they have a decreased metabolic rate because there's not a need for higher temps. Gender, body temperatures increase during ovulation. Hormones affecting the metabolism or tissue injury and repair and release of the egg. Watch temperature to plan or avoid pregnancy. Exercise, muscle contraction and heat, otherwise known as friction, causes shivering. Contractile thermoneogenesis is what that's called. This is to provide needed calories from an increase in metabolic rate. Endocrine hormones are released from pituitary, thyroid, and adrenal glands. As activity decreases, metabolic rate decreases, and you become colder. Fahrenheit scale and centigrade scale. Fahrenheit scale uses 32 degrees Fahrenheit as the temperature at which water freezes and 212 degrees Fahrenheit as the point at which it boils. Centigrade scale uses 0 degrees centigrade as the temperature at which water freezes and 100 degrees centigrade as the point at which it boils. In normal healthy adults, shell temperature generally ranges from 96.6 to 99.3 Fahrenheit or 35.8 to 37.4 centigrade. Chances of survival diminish if body temps exceed 110 Fahrenheit or fall below 84 degrees Fahrenheit. Based on temperature, animals are either poikilothermic, which temperature fluctuates depending on environmental temperatures, or homeothermic. Structural and physiologic adaptations keep body temperature within a narrow, stable range. The anterior hypothalamus controls the metabolic activities and temperature regulation. The anterior hypothalamus promotes heat loss by vasodilation and sweating. The posterior hypothalamus concerns itself with heat conservation and heat production. Heat conservation is controlling where the blood circulates. It causes pileoerection, which is contraction of erector pili muscles in skin follicles, stiffens the body hairs, and causes what we call goosebumps. This promotes shivering and promotes heat production. Heat production is also accomplished through increasing metabolism by increased secretion of the thyroid hormone and epinephrine and norepinephrine from the adrenal medulla. These hormones control core temperatures at a set point within 1 degree centigrade through the skin temperature and the blood temperature. Accurate assessment sites for temperatures are the brain, heart, lower third of the esophagus, and the urinary bladder. Practical and convenient assessment sites are the ear, temporal artery on the forehead or behind the earlobe, mouth, rectum, and axilla. Ear temporal artery provide the temperature closest to the core temperature. The reason the ear temperature is so accurate is because the tympanic membrane is 1.4 inches from the hypothalamus in the brain. Again, to get an accurate reading, the ear thermometer must be inserted correctly and do not use under 2 years of age. The temporal artery lies 2 millimeters below the skin, and that's why the temporal thermometer is accurate as well. It's the same as the heart temperature. Clinical thermometers include electronic with a sheath, usually infrared, which is tympanic and detects warmth radiation from tympanic membranes. Chemical are the dots on the paper strips, and digital, as you know, um, reads in digital form. Temporal is done with infrared heat radiating from the temporal artery and the center of the forehead, and the heat loss of heat through the skin uses computerized algorithms to measure every millimeter across. If you go across the forehead, it uses algorithms to average out the temperature. The electronic thermometer is a sublingual thermometer. As you can see, it has a plastic sheath that goes in and underneath the tongue. This must be charged. There's a charging unit. Again, the plastic sheath should be changed between patients. Do not set it on the bedside. Make sure you refill the box. Put the back snugly in the charger. The blue thermometer probe is for oral and the red is for rectal. The infrared tympanic thermometer, the most important thing is the position. You need to change probes between patients. You must have the right size of probe. There are different sizes. You direct the probe toward the tympanic membrane. In adults, be aware of wax interfering. Also, fluid behind the tympanic membrane can interfere with a proper temperature reading. The drawdown effect, the cooling of the ear, happens if the thermometer touches the ear canal skin. It's a reflex. The chemical thermometer is the Tempedots. They're inexpensive, they're good for isolation patients, and they are disposable. And again, these are sublingual. You put them underneath the tongue, you leave them in for a minute, take it out, and read the dots. And there'll be blue dots up to the point where the temperature can be read. Automated monitoring devices are equipment that allows for the simultaneous collection of multiple data. They can measure the temperature, blood pressure, pulse, heart rhythm, and pulse oximetry. They're portable and they save time and money. Generally speaking, they're a rolling machine that has the blood pressure cuffs, the O2 sat cord with the clamp. Thermometer is usually a separate unit on it, and it is portable. You can take it from room to room. The fixed automated devices are obviously not portable. They can also assess heart rhythms, and you will have electrodes on your patient. The fixed automated devices are used primarily in critical care areas. In this case, these particular monitors measure body temperature using internal thermistor probes within the esophagus of an anesthetized client. Also could be inside the bladder or attached to a pulmonary artery catheter. Those are the ones you see in the ICU. Fever is a condition in which the body temperature exceeds 99.3 Fahrenheit or 37.4 centigrade. Pyrexia is a condition in which the temperature is warmer than the normal set point. Hypothermia is a condition in which core temperature is excessively high and the temperature exceeds 105.8 degrees Fahrenheit or 40.6 degrees centigrade. Terms to remember: febrile means you have a fever. Afebrile means you do not have a fever. Signs and symptoms of fever include pink, flushed skin or red skin, restlessness, sleepiness, irritability, decreased appetite, glassy eyes, light sensitivity, increased sweating, headache. Respiratory rate can be faster, pulse rate also up. Very likely to have disorientation and confusion if the temp is very high. Convulsions in infants and children when it is very high can occur. Fever blisters and in nose and lips can occur with those with herpes simplex virus. They'll have a breakout. Hyperthermia, again, is 105.8 or greater, and there is a high risk of brain damage or problems with high metabolic demands. Symptoms of fever again is pinkish red flushed skin that's warm to the touch, restlessness in some, excessive sleepiness in others, irritability, poor appetite, glassy eyes, sensitivity to light, increased perspiration, headache, above normal pulse and respiratory rates, disorientation and confusion if it's very high, convulsions in infants and children, again when the temp is very high, and fever blisters can occur about the nose or lips in clients who have the herpes simplex virus. Phases of fever, the prodromal phase is there's no specific signs and symptoms. Usually you have muscle aches, a mild headache, lethargy, and decreased appetite. The onset or invasion phase is obvious, increase in temperature. There's mechanisms going on at this point for shivering. You could have paleness and cold skin. Stationary phase is fever sustained. There's flushed skin and it feels hot. Resolution or defervescence phase is when sweating begins and the temperature goes down. If fever suddenly drops to normal, it is called resolution by crisis. If fever descends slowly, then the resolution is called lysis, L-Y-S-I-S. If the fever is 102 to 104 degrees, antipyretics are used. Fever reducers such as acetaminophen, aspirin, ibuprofen, to prevent liver damage do not exceed 3,250 to 4,000 milligrams of Tylenol in 24 hours. Again, between 3,000 and 4,000 over 24 hours is the maximum. Sustained fever is fever with little change. Remittent fever is it fluctuates several degrees but never really goes down to normal. Intermittent fever is cyclic, frequency between periods of normal or subnormal temperatures and spikes of fever. Relapsing fever it recurs after a brief but sustained period of normal temperatures. True or false? Fever is a condition where the body temperature exceeds 105.8. False. Fever is a condition where the body temperature exceeds 99.3. Hypothermia. Core body temperature is less than 95 degrees Fahrenheit or 35 degrees centigrade. Mildly hypothermic is 95 to 93.2 Fahrenheit or 35 centigrade to 34 centigrade. Moderately hypothermic is 93 to 86 degrees Fahrenheit or 33.8 to 30 degrees centigrade. Severely hypothermic is below 86 degrees Fahrenheit or 30 degrees centigrade. In your book, Pernanda, page 202 in Fundamentals, for fever, you want to cover a client who is shivering. You want to provide a warm but not hot environment. Remove blankets, heavy clothing once the shivering stops. Also limit activity, push fluids, give light, high-calorie, frequent nourishment, give antipyretics, no aspirin due to the risk of Reye's syndrome, which could cause liver damage and brain damage. That follows, Reye's syndrome follows giving aspirin to a child who has a cold, a flu, or chickenpox. And it is rare, but it does occur from giving aspirin. You also want to apply cool cloths or ice packs to the forehead, behind the neck, in the axillary and inguinal folds. Keep the room ventilated with a fan and keep the humidity low. If the shivering does not stop, shivering does not stop until the hypothalamus reaches a higher set point. Apply tepid water to skin is another thing to do for fever. Sponge baths every 30 minutes after giving meds. Stop cooling measures if the patient starts shivering. And apply an electronic cooling pad if ordered. Symptoms of hypothermia: shivering until the body temperature is extremely low, pale, cool and puffy skin, impaired muscle coordination, listlessness and irregular heart rhythm, slow pulse and respiratory rates, incoherent thinking, and diminished pain sensation. A hypothermic patient could look dead, but is not considered dead until their body is warmed up, and then they are considered dead. So they could appear to be dead in a hypothermic state and not actually be dead. As far as nursing interventions for subnormal temps, you want to increase the room temperature, remove wet clothing, apply layers of warm clothing and blankets. You also could warm the layers of clothing before you apply them. The position sometimes with this is a fetal position. You want to cover the head with a cap or towel, provide warm fluids, massage the skin unless frostbitten, apply bags of warm water to the skin folds or electronic heating pads to the back and hips. Pulse. The pulse is produced by the movement of blood during the heart's contraction. In most adults, the heart contracts 60 to 100 times per minute at rest. There is descriptions of pulse considering pulse rhythm, pulse volume, and pulse rate. And in addition, we do have peripheral pulse locations. Pulse rhythm is the pattern of pulse, and if it pauses in between, what the pattern is. Pulse volume is the amount of blood pumped with each heartbeat or force of heart's contraction. Pulse rate is the number of pulsations per minute felt by the tips of the fingers at the radial artery. Peripheral pulse locations are named for the bone underneath them. Although apical is above on top of the heart, the base of the heart, it's easier to hear, and also because the blood is being pushed out from the ventricles out the major aortas, and you can feel the contractions there the best. 0 to 4 plus in rating pulse. 0 is an absent pulse, 1 is a thready pulse, which is mild, feeble, weak. Bounding or full pulse is a 4, and normal would be a 3. You want to report pulses greater than 100 or less than 60. 60 or less can be common in some patients depending on medications, but you must report it. Factors that affect the pulse and heart rate are age, circadian rhythms. In the morning it'll be lower, in the afternoons or evenings it'll be higher. Gender, generally speaking, males are 60 to 65 at rest, females are 70 to 80 at rest. Tall, thin, people are slower in heart rate than short and stout. Exercise and activity. If you have a lot of activity, you're going to be a slower heart rate at rest if you're active. Older adults also run risks of slower pulses with medications, which, especially cardiovascular meds, which increase the chance of dizziness, low blood pressure, and they can have disorientation and visual changes. Stress and emotions also and pain affect pulse rates. That would be usually increasing. Body temps, for every 1 degree increase in temperature, the heart rate increases by 10 beats per minute. For every decrease in temperature by 1 degree, the heart rate decreases by 10. Blood volume, if you have low blood volume, your heart rate and pulse rate is going to be higher. If you have low RBCs or low hemoglobin, your heart rate is going to be higher. Drugs such as digoxin and sedatives are going to lower your heart rate. Caffeine, nicotine, cocaine, thyroid replacement, epinephrine are all going to increase the contractions of the heart. Primary pulse assessment sites, the radial artery located at the inner thumb side of the wrist. Alternate assessment techniques are counting the apical heart rate, obtaining an apical radial rate, and using a Doppler ultrasound device over a peripheral artery. The apical heart rate, as you know, is on the left side of the body at the 5th intercostal space and the mid-clavicular line, just below the left nipple. When you obtain an apical radial rate, you'll need 2 nurses, one listening to apical and one feeling for a radial rate, and then you compare the two. If there is a significant difference between the apical and radial pulse rates, you must report. A Doppler uses electronic sound waves to detect blood through peripheral blood vessels. When arterial flow is compromised, you can hear it, and other pulse sites, in addition to the radial, would be the temporal, the carotid, the brachial, the apical, the radial, the ulnar, the femoral, the popliteal, the dorsalis pedis, and the posterior tibialis. Respiration is defined as the exchange of oxygen and carbon dioxide. Respiratory rate is the number of ventilations per minute. Cheyne-Stokes respiration is a breathing pattern in which the depth of respiration gradually increases, followed by a gradual decrease, and then a period when breathing stops briefly before resuming again. Normal respiratory rate is 12 to 20. In a newborn, it can be 30 to 80. Tachypnea is a rapid respiratory rate, along with increase in temperature usually, or cardiovascular and respiratory diseases. Bradypnea is a slower respiratory rate, usually at rest due to abnormal breathing characteristics are hyperventilation, hypoventilation, dyspnea, which is difficulty breathing. Orthopnea is difficulty breathing unless you're sitting up. Apnea is periods of no breathing, and stertorous breathing sounds like a loud snoring sound. Stridor is a high-pitched, almost like a whistle, because the airway is inflamed in the throat. Blood pressure is the force that the blood exerts within the arteries. Lower than normal volumes of circulating blood cause a decrease in blood pressure. Excess volumes cause an increase in blood pressure. Regular aerobic exercise increases tone of heart muscle and increases efficiency. Cardiac output is approximately 5 to 6 liters in adults at rest. Blood pressure measurements provide physiologic data about the ability of the arteries to stretch, the volume of circulating blood, and the amount of resistance the heart must overcome when it pumps blood. Factors that affect the blood pressure are age, the circadian rhythms, gender, exercise and activity, emotions and pain, and lower blood pressure could occur when lying down as opposed to sitting or standing. Higher blood pressure can occur when the urinary bladder is full, when the legs are crossed, or when the person is cold. Also when drugs that stimulate the heart are taken. Pressure measurements are systolic, diastolic pressures. Blood pressure is expressed in millimeters of mercury, mmHg, as a fraction, systolic pressure over diastolic pressure. Pulse pressure is the difference between systolic and diastolic blood pressure measurements. Blood pressure is usually assessed over the brachial artery. It can be also assessed in the lower arm and radial artery. It can be measured over the popliteal artery behind the knee. In the case of the client's arms are missing, both of a client's breasts have been removed, or a client has had vascular surgery. Equipment for measuring blood pressure: sphygmomanometer, aneroid manometer, electronic oscillometric manometer, inflatable cuff, and a stethoscope. Measuring blood pressure. Phase 1 is the first faint but clear tapping sound that follows a period of silence as pressure is released from the cuff. Phase 2 is a change from tapping sounds to swishing sounds. Phase 3 is change to loud and distinct sounds, crisp knocking sounds. Stage 4 are sounds muffled and has a blowing quality, is the first diastolic pressure measurement. And phase 5, the point at which the last sound is heard, second diastolic pressure measurement. Characteristics of Korotkoff sounds shown here. Is the following true or false? The first diastolic measurement is taken at phase 3 of Korotkoff sounds. This is false. First diastolic measurement is taken at phase 4 of Korotkoff sounds. Alternative techniques for assessing blood pressure include palpation, using a Doppler stethoscope, automatic blood pressure monitoring, and measuring thigh blood pressure. Abnormal blood pressure measurements. Blood pressure above or below normal ranges indicates significant health problems. Hypertension is high blood pressure. Hypotension is low blood pressure. Postural or orthostatic hypotension is sudden but temporary drop in blood pressure when rising from a reclining position. Hypertension or high blood pressure is associated with anxiety, obesity, vascular diseases, stroke, heart failure, and kidney disease. This is the end of the slideshow.